Hello everyone, now let us discuss about CPT coding guidelines for radiology part 10. In the current session, we will be focusing about radiation oncology. Now let us discuss about various aspects that are dealt in radiation oncology. Radiation oncology is composed of initial consultation, clinical treatment planning, simulation, medical radiation physics, dosimetry, treatment devices and special services, clinical treatment management procedures. So first coming to initial consultation. Preliminary consultation, evaluation of patient prior to decision to treat or full medical care. In addition to treatment management, when provided by therapeutic radiologist, may be identified by appropriate procedures code from E&M medicine or surgery sessions. So initial consultation can be given appropriate procedure codes from E&M medicine and surgery sessions. Initial consultation is nothing but preliminary evaluation of patient prior to the decision to treat. Now coming to clinical treatment planning. The various areas which are dealt in clinical treatment planning are interpretation of special test, tumor localization, treatment volume determination, time and dosage determination, choice of treatment modality determination, determination of number and size of treatment ports, selection of treatment devices. These are the various areas that are encompassed in clinical treatment planning. Now coming to the types of clinical treatment planning. In the previous slide, we have discussed about the various areas that must be covered in the process of clinical treatment planning. So based on those areas, the clinical treatment planning is divided into three types: simple, intermediate and complex. They have specific definitions that will be dealt next. So as of now, simple means it involves single treatment area. Intermediate means it involves two separate treatment areas, whereas complex means it involves three or more treatment areas. The types of clinical treatment planning. Now coming to the definition. Simple means planning requires a single treatment area of interest encompassed in a single port or simple parallel opposed ports with simple or no blocking. Treatment area must be single, which is encompassed in a single port. Port must also be single or simple parallelly opposed ports with simple or no blocking. That involves simple clinical treatment planning. Now coming to intermediate clinical treatment planning, the planning requires three or more converging ports, two separate treatment areas, multiple blocks or special time dose constants. Now coming to complex clinical treatment planning, the planning requires highly complex blocking, custom shielding blocks, tangential ports, special wedges or compensators, three or more separate treatment areas, rotational or special beam considerations, combinations of therapeutic modalities. These are all the aspects that are involved in complex treatment planning. Now let us discuss about the CPTs. The first CPT is 77261, which is nothing but therapeutic radiology treatment planning simple. The next is 77262. It involves therapeutic radiology treatment planning intermediate. The next is 77263. It involves therapeutic radiology treatment planning complex. Now coming to next area, simulation. The first is initial consultation, the next is clinical treatment planning, and the next is simulation in radiation oncology. So what is simulation? Simulation is a process of defining relevant normal and abnormal target anatomy and acquiring the images and data necessary to develop optimal radiation treatment process for the patient. Simulation is a process of defining relevant normal and abnormal target anatomy and acquiring the images and data that are necessary to develop optimal radiation treatment process for a particular patient. A simulation is defined as complex if it involves these following criteria. So whenever particle rotation or arc therapy, complex or custom blocking, or brachytherapy simulation, or hyperthermia probe verification, or use of any contrast material. Whenever these criteria are met, then simulation is considered or defined as complex. If a simulation does not meet any of these criteria, the complexity is defined by number of treatment areas. Usually whenever custom blocking is involved or brachytherapy simulation is involved or hyperthermia probe verification is involved, in all these cases simulation is considered as complex. If it does not meet any of these criteria, the complexity is defined by number of treatment areas. Now, what is a treatment area in the radiation oncology? A treatment area is a contiguous anatomical location that will be treated with radiation therapy. Generally, this includes the primary tumor organ or resection bed or the draining lymph node chains if indicated. For example, in a breast cancer patient, a single treatment area could be breast alone, that is nothing but the tumor organ, or it can be adjacent supraclavicular fossa, which is the resection bed, or it can be internal mammary nodes, which are the draining lymph node chains. So any of these locations can be a single treatment area. In some cases, a patient might receive radiation therapy to more than one discontinuous anatomic location. For example would be patient with multiple bone metastasis in separate sites, for example, femur and cervical spine. In this case, each distinct and separate anatomical site that is to be irradiated is a separate treatment area. That is, femur is a separate treatment area and cervical spine is a separate treatment area in a case of multiple metastasis of bone. So each distinct and separate anatomical site that is to be irradiated is considered to be a separate treatment area. Now coming to the types of simulation. It can be simple, intermediate or complex. If only single treatment area is involved, it is simple. If two separate treatment areas are involved, it is intermediate. If three or more treatment areas are involved, it is complex. And if any of the following is involved, that is particle, rotation or arc therapy, complex or custom blocking, brachytherapy simulation, hyperthermia probe verification, use of any contrast material also contributes the complexity of simulation apart from the treatment areas. Now coming to the CPTs for simulation. The first CPT is 77280, which is nothing but therapeutic radiology simulation aided field setting, simple, that is nothing but one treatment area. The next is 77285, therapeutic radiology simulation aided field setting intermediate, which is nothing but two treatment areas. The next is 77290, which is therapeutic radiology simulation complex, that is more than 3 areas or any of the following. For example, custom blocking or brachytherapy, etc. The next is an add-on code plus 77293, which is nothing but respiratory motion management stimulation. The code 77293 must be used in conjunction with 77295 and 77301. The next code is 77299, which is unlisted procedure therapeutic radiology clinical treatment plan. Now coming to medical radiation physics, dosimetry, treatment devices and special services. The first CPT is 77295, which is an out of sequence code, hence it is indicated by number sign. The description is 3-dimensional radiation plan including dose volume histograms. The next is 77300, basic radiation dosimetry calculation, central axis depth dose calculation, TDF, NSD, gap calculation, off-axis factor, tissue inhomogeneity factors, calculation of non-ionizing radiation surveys and depth dose as required during course of treatment only when prescribed by physician. The next is 77301, which is intensity modulated radiation therapy plan, including dose volume histograms for target and critical structure, partial tolerance specifications. The next is 77306, teletherapy isodose plan, simple. 1 or 2 unmodified ports directed to single area of interest. Includes basic dosimetry calculation. Teletherapy isodose plan, simple, is given by CPT 77306. The next is 77307. Teletherapy isodose plan, complex. Multiple treatment areas, tangential ports, use of wedges, blocking, rotational beam or special beam considerations. Includes basic dosimetry calculation. The next is 77316, which is nothing but brachytherapy isodose plan, simple. That is, the calculations are made from 1 to 4 sources or remote afterloading brachytherapy for one channel. Includes basic dosimetry calculations. The next is 77317, brachytherapy isodose plan, intermediate. Intermediate means it involves 5 to 10 sources or 2 to 12 channels of remote afterloading brachytherapy. The next is 77318, brachytherapy isodose plan, complex. That is, over 10 sources or 12 channels. All these things, all these three codes, 77316, 317 and 318, include the basic dosimetry calculations. The next code is 77321, special teletherapy port plan, particles, hemibody, total body. The next is 77331, special dosimetry, which is nothing but TLD or microdosimetry, only when prescribed by a treating physician. The next is 77332, treatment devices, design and construction, simple. That is, simple block or simple bolus. The next is 77333, treatment devices, design and construction, intermediate, which is nothing but multiple blocks, stunts, bite blocks, special bolus. The next is 77334, treatment device, design or construction, complex, which involves irregular blocks, special shields, compensators, wedges, molds or casts. The next is 77336, continuing medical physics consultation, including assessment of treatment parameters, quality assurance of dose delivery and review of patient treatment documentation in support of radiation oncologist, reported per week of therapy. The next code is 77338, which is nothing but multi-leaf collimator MLC device for intensity modulated radiation therapy, IMRT, design and construction per IMRT plan. MLC device for intensity modulated radiation therapy is given by 77338. The next is 77370, special medical radiation physics consultation. Now coming to stereotactic radiation treatment delivery. The CPTs are 77371, which involves radiation treatment delivery, stereotactic radiosurgery, SRS. Complete course of treatment of cranial lesions consisting of one session, multi-source, cobalt 60 based. The next CPT is 77372, which is radiation treatment delivery, stereotactic radiosurgery, complete course of treatment of cranial lesions consisting of one session, linear accelerator based. Along with, for radiation treatment management, use 77432, stereotactic radiation treatment management of cranial lesion. 77372 can be used along with 77432, which is nothing but stereotactic radiation treatment management of cranial lesion. The next is 77373, stereotactic body radiation therapy treatment delivery, perfraction to one or more lesions, including image guidance, entire course not exceeding 5 fractions. The next is 77399, unlisted procedure, medical radiation physics, dosimetry, treatment devices, special services. Now let us discuss an example. A 65-year-old female has 2.5 centimeters by 2 centimeters non-small lung cancer in her right upper lobe. The tumor is inoperable due to severe respiratory condition. She will be receiving stereotactic body radiation therapy under image guidance. Beams are arranged in 8 fields will deliver 25 gray per fraction for 4 fractions. What CPT? Here, radiation therapy, stereotactic body radiation therapy under image guidance is performed. So, appropriate CPT is 77373. Stereotactic body radiation therapy, treatment delivery per fraction to 1 or more lesions, including image guidance, entire course not exceeding 5 fractions. Here 4 fractions are used. So this is the appropriate CPT 77373. By this we complete the stereotactic body radiation therapy. Now coming to radiation treatment delivery. So following dosimetry calculations, there are number of alternate methods to deliver external radiation treatments. After the calculations, there are number of alternative methods to deliver the radiation treatment. They are nothing but radiation treatment delivery. So radiation treatment delivery can be X-ray or photon, which includes conventional and intensity modulated radiation therapy, which is nothing but IMRT. Radiation treatment delivery can be delivered by electron beams, neutron beams, proton beams or X-rays. X-rays include conventional and intensity modulated radiation therapy beams. Now coming to some of the guidelines for radiation treatment delivery. All treatment delivery codes are reported once per session and the delivery codes recognize technical only services and contain no physician work. Treatment delivery codes, they recognize only technical services and not contain any physician work, which is nothing but the professional component. In contrast, the treatment management codes, they contain only the professional component. Treatment delivery codes, they contain only technical component, whereas treatment management codes, they contain only professional component. Now we are discussing about radiation treatment delivery and next we will discuss about radiation treatment management. So as of now, the radiation treatment delivery codes, they recognize technical services only. Radiation treatment delivery with conventional X-ray or electron beam is assigned levels of complexity based on the number of treatment sites and complexity of the treatment fields by using blocking wedges or physical or virtual tissue compensators. A simple block. What are blocks? A simple block is a straight edged or an approximation of a straight edge created by multi-leaflet collimator, which is nothing but MLC, and the energy of megavolt greater than or equal to 1 megavolt beam does not contribute to complexity. Techniques such as, usually the complexity is based on number of treatment sites and treatment fields and using of blocking wedges or any physical or virtual tissue compensator. The energy aspect alone does not contribute to complexity. That is the amount of energy used. It does not contribute to complexity. Whereas techniques such as treating a field in field to ensure dose homogeneity, they reflect the added complexity. Energies below the megavolt range are usually used to treat skin lesions. Now coming to types of radiation treatment delivery. Types of radiation treatment delivery, megavolt energy, greater than or equal to 1 MeV, any energy. Types are simple, intermediate and complex. Coming to the description of simple, it involves single treatment area, 1 or 2 ports 2 or less simple blocks. Now coming to intermediate radiation treatment delivery, it involves 2 separate treatment areas, 3 or more ports on single treatment area, 3 or more simple blocks. The next is complex radiation treatment delivery. It involves 3 or more separate treatment areas, custom blocking, tangential ports, wedges, rotational beam, field, infield, or other tissue compensation. So these are the types of radiation treatment delivery. Now coming to intensity modulated radiation therapy, which is nothing but IMRT, intensity modulated radiation therapy. Intensity modulated radiation therapy use computer based optimization technique with non-uniform radiation beam intensities to create a highly conformal dose distribution that can be delivered by radiotherapy treatment machines. IMRT use the computer-based optimization techniques with the non-uniform radiation beam intensities to create highly conformal dose distribution. That is nothing but intensity modulated radiation therapy. Number of technologies include spatially or temporally modulated beam, cylindrical beamlets, dynamic MLC, which is nothing but multi-leaf collimator, single or multi-field or arcs, compensators, etc. are used to generate IMRT. These are the various technologies that are used to generate intensity modulated radiation therapy. The complexity of intensity modulated radiation therapy may vary depending upon the area being treated or the technique being used. Now coming to the types. Intensity modulated radiation therapy, any energy, it includes technical services to guidance. This is an important point. The IMRT, intensity modulated radiation therapy, includes the technical services to guidance whenever used. It can be either simple or complex. Simple involves prostate or breast and all sites using physical compensator based IMRT. If IMRT is used to treat prostate or breast or any site using physical compensator based IMRT, then that IMRT is considered as simple. So, if IMRT is used to treat all other sites or if they are not using compensator based IMRT, then also the IMRT is considered as complex. Apart from prostate and breast, all other sites is one criteria, and any site that are not using compensator based IMRT is considered as complex IMRT. Now coming to image guided radiation therapy, IGRT. So guidance may be used with any radiation treatment delivery technique, and it is typically used with IMRT delivery. This is an important point. Guidance may be used with any radiation treatment delivery technique, but it is typically used with IMRT, which is nothing but intensity modulated radiation therapy. So IGRT is used along with IMRT, and it is used to direct the radiation beam to reflect motion during the treatment, and the guidance can be achieved by imaging or non-imaging techniques. The imaging techniques involve CT, MRI, ultrasound or stereotactic imaging, and the non-imaging techniques involve electromagnetic or IR techniques. The IMRT delivery codes include the technical component of guidance or tracking whenever performed. As we have discussed earlier, the IMRT delivery codes, they include the technical component of guidance or tracking whenever performed. So, in simple words, IMRT, the technical component of IGRT is bundled with IMRT. The technical component of IGRT is bundled with IMRT. Because only technical component of IGRT is bundled into IMRT, physician involvement in guidance or tracking may be reported separately in order to indicate the professional component. Because only the technical component of IGRT is bundled into IMRT, physician involvement in guidance or tracking may be reported separately. So when guidance is required with conventional radiation delivery treatment, both professional and technical components are reported. This is also an important point. When guidance is required with conventional radiation treatment delivery, both professional and technical components are reported because neither of the component of guidance is bundled into conventional radiation treatment delivery services. Now coming to the various CPTs of radiation treatment delivery. The first CPT is 77401, which is nothing but radiation treatment delivery superficial and or ortho voltage per day. The next is 77402, which involves radiation treatment delivery greater than 1 megavolts. Simple. The next is 77407, radiation treatment delivery intermediate. The next is 77412, radiation treatment delivery complex. Now coming to next CPT, that is 77417, which is nothing but therapeutic radiology port images. The next is an out of sequence code, hence it is indicated by number sign 77385, which is nothing but intensity modulated radiation treatment delivery IMRT, includes guidance on tracking when performed. Simple. The next code is 77386, which is nothing but intensity modulated radiation treatment delivery IMRT, including guidance and tracking when performed. Complex. The next is 77387, which is nothing but guidance for localization of target volume for delivery of radiation treatment, including intrafraction tracking when performed. The next code is 77424. This is also out of sequence, hence it is indicated by number sign. 77424 involves intraoperative radiation treatment delivery, X-ray single treatment session. The next is 77425, intraoperative radiation treatment delivery, electrons single treatment session. Now let us discuss an example. A patient with prostate cancer has his first dose of radiation treatment of a single area that requires single port of energy level 7 milli electron volts MeV. What CPT is to be coded? Here radiation treatment delivery involves single area and single port. So radiation treatment delivery is simple, 77402. Energy used is greater than 1 MeV. Energy used is 7 MeV. Now coming to neutron beam treatment delivery, there is only one CPT under neutron beam treatment delivery, that is 77423. High energy neutron radiation treatment, one or more isocenters with coplanar geometry with blocking or wedges or any compensate. Now coming to the final topic, radiation treatment management. The important rule in radiation treatment management is the radiation treatment management is reported in units of 5 fractions or treatment sessions. 5 fractions or treatment sessions regardless of actual time period in which the services are furnished or done. The services need not be furnished on consecutive days. And suppose at the end of the day or at the end of the treatment session, multiple fractions representing 2 or more treatment sessions furnished on the same day. Multiple fractions representing 2 or more treatment sessions furnished on the same day may be counted separately as long as there has been a distinct break in a therapy session. Suppose on whole 8 treatment sessions have been done on the same day, provided there has been a break in the therapy sessions. Then we can code them separately. Suppose 4 sessions are done at one time and 4 sessions are done at some other time, but there has been a distinct break in the therapy sessions. So on total you can consider 8 treatment sessions for that particular day. Now coming to the code 77247. It is reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of course of treatment. So in simple terms, for every 5 units or treatment session, 1 CPT is reported. 77247 is reported for every 5 units. In addition to the 5, if there are 3 or 4 fractions beyond the multiple of 5, that is if there are 8 or 9 treatment sessions in the same day, then you can use 2 units of 77247. But if the fractions are less than 2, then only 1 77247 is reported. In simple words, code 77247 is reported to a maximum of 7 treatment units or treatment sessions. Code 77247 is reported to a maximum of 7 treatment sessions. The radiation treatment management requires and includes a minimum of 1 examination of the patient by physician for medical evaluation and management. That is for assessment of patient's response to treatment, coordination of care and treatment, reviewing of images or lab tests with documentation. For each reporting of radiation treatment management service. Radiation treatment management requires 1 examination of patient by physician for each reporting radiation treatment management service. And the code 77469 represents only the intraoperative session management and does not include the medical evaluation and management outside that session. And the professional services that are done during the treatment management include reviewing of port images, review of dosimetry, dose delivery and treatment parameters, review of patient treatment setup, etc. In simple words, radiation treatment management requires 1 examination of patient by physician for every radiation treatment planning service. For each reporting radiation treatment planning service, 1 examination of patient by physician is required. Now, one more point is stereotactic radiosurgery management. Stereotactic radiosurgery management and stereotactic body radiation treatment management. They are represented by codes 77432 and 77435. They both include the professional component of 77387. Which is nothing but guidance for localization of target volume for delivery of radiation treatment, including intrafraction tracking whenever performed. (77387) is nothing but guidance for localization of target volume which requires a physician. But whenever we are coding 77432 and 77435, these two codes, they include the professional component of 77387. So you need not additionally report the professional component when coding 77432 and 77437. Now coming to the various CPTs of radiation treatment management. The first CPT is 77427. Radiation treatment management, 5 treatments. It can be used to a maximum of 7 treatments. It is better if we write here 77427 is used to a maximum of 7 treatments. The next is 77431, radiation treatment management with complete course of therapy consisting of 1 or 2 fractions. The next is 77432, stereotactic radiation treatment management of cranial lesion. The next is 77435, stereotactic body radiation therapy treatment management per treatment course to 1 or more lesions including image guidance, entire course not exceeding 5 fractions. The next CPT is 77469, which involves intraoperative radiation treatment management. The next is 77470, special treatment procedure, that is total body radiation, hemi-body radiation per oral or endocavity irradiation. The next is 77499, which is nothing but unlisted procedure, therapeutic radiology treatment management. Let us discuss an example. An oncology patient is having weak radiation treatment with a total of 7 conventional fractionated treatments. 7 treatment sessions, 2 fractionated daily for Monday, Tuesday and Wednesday, and 1 treatment on Thursday. What radiology code are appropriate for clinical management of radiation treatment? So on a whole, 7 sessions are done. So the appropriate CPT is 77427, radiation treatment management, 5 treatments to a maximum of up to 7 units. Now coming to proton beam treatment delivery. Now coming to the types of proton beam treatment delivery, it can be simple, intermediate or complex. Simple involves single treatment area utilizing a single non-tangential oblique port, custom blocking with compensation or without compensation. 77520 is reported for without compensation and 77522 is reported for with compensation, simple proton beam delivery. Next, coming to intermediate proton beam delivery. 1 or more treatment areas utilizing 2 or more ports or 1 or more tangential or oblique ports with custom blocking and compensator. The code is 77523 for intermediate proton beam delivery. Now coming to complex proton beam delivery, which is given by 1 or more treatment areas utilizing 2 or more ports per treatment area with matching or patching fields and or multiple isocenters with custom blocks and compensators. The appropriate CPT is 77525. Now coming to the description of various CPTs. 77520, which is nothing but proton treatment delivery, simple without compensation. 77522 is nothing but proton treatment delivery, simple with compensation. 77523 is proton treatment delivery, intermediate, and 77525 is proton treatment delivery, complex. By this, we complete the entire radiology topic. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.